When something is at stake, you will really
Isolate. And then dry.
Ngayon pa lamang sa bahay pa.
Okay. And then, for example, you're asked to do cold test. If you're asked to do cold test, and the offending tooth is 1-1, again, you will do it on the contralateral and the adjacent as long as these two are normal. If these are not normal teeth, you have to go to other teeth. Okay? And how do you do it? This is one of the best cold tests. You shake it well. Shake it well. And then spray. Okay? Then place it on the tooth. Now, this is the instruction to the patient. I'm going to put something cold on your tooth. If you feel something like there's pain or sensitivity, or it's not necessary that you feel anything. But once you feel something, please raise your right hand. If you don't feel anything already, put it back. Okay? Now, what will you do as a clinician? Once you place the, for example, if I place it here, you have to time how many seconds does the patient raises the right hand. So you have to time it. So your watch should be here. Okay? Once the patient feels it, once the patient raises his right hand, you remove the stimulus and then time again how long does it take for the patient to put it back. So you got 2. Okay, let's see how.
So I know.
So instruction again. I'll put something cold on your tooth. If you feel it, raise your right hand. Once you don't feel it anymore, you put it back. So shake it well, spray, then put on the contralateral. 1, 1. So what was the reading? The patient felt it 1. When I place it, immediately raises the hand. I remove this and then puts it back. So wala na ba? Then you do it on the other tooth. If you do it on the other tooth, you have to get another. Shake it well. See? It's the same thing. 1, 1. Immediately. What does it mean? You have to interpret the result. The tooth is normal. The patient feels the same thing on the offending tooth and on the other normal tooth. Okay? Next, heat test. With a heat test, the same thing, you have to isolate the tooth and dry. Since you're going to use heated gutta-percha, you have to put Vaseline on the tooth. Why? Because you don't want this to stick. So put Vaseline. Okay, apply Vaseline on the tooth so the gutta-percha won't stick. Okay, I place on the 3 teeth that you're going to use.
Are you laughing?
Okay, and then this is how to hit the gutta-percha.
Now I Christmas tree.
Hanging upon.
Ito mo ng konti.
Okay, hit it.
Ayusin mo na yung mga laylayan.
Oh, nasunog na. That's how it is.
Yun yung baka, no?
And contralateral. Can you feel? Okay, what is the instruction again? Once you feel something, raise your right hand. Once you don't feel anything, you put it back. Okay. You have to get 2 times, 2 timers, and then tell me the interpretation. Let's start. Okay? Can you see after the patient felt it, I have to remove the stimulus and time again. Okay? So you do it also on the other tooth and finally on the offending tooth and tell me the interpretation. Since the patient had it 1, 1, 1, 1, the tooth is normal and it is vital normal. Okay? Then after that, you have to clean the tooth. See, if there's gutta percha here, just remove it. It can be removed easily because you have placed Vaseline. Okay? So the next test is the EPT. What is the instruction to EPT and how do you do it? Number 1. Okay? When this comes to you, it's like this. Okay? Separated. So number 1, the lip clip should be inserted. And then the other end should be placed here. And then get an alcohol, soak this with alcohol and clean. Clean. Then put it on the patient's lip. And then instruction again. I will put something on your tooth. Once you feel it, raise your right hand. But actually, even if the patient will not raise the right hand, the patient will just jerk. So you stop. So example. Example muna ha. Since you need a conductor, you need a toothpaste. So when you place the toothpaste, just get from the tip, okay? And then place it on the tooth. The instruction to the patient is, I'm going to place something. If you feel it, raise your right hand. So what are you supposed to see? Readings here. Okay, you have to press the button. Continue pressing it until the patient feels it. Okay? Once the patient feels it, you remove your finger. So the reading that you're supposed to give to me is 22 and tell me the interpretation. What does it mean? The tooth is vital. But if it reaches 64 and the patient did not feel anything, that means the tooth is non-vital. Is that clear? Okay. So let's start to 0. So now, this is, sorry Okay. So you have the conductor. Clean, dry, isolate. Place it on the tooth and just at the middle. And then start. See? It's 4. So that's the reading. 4. So what's your interpretation? The tooth is vital. Sakit? So done. After you're done, you have to get alcohol. Clean it. Okay, clean. And then remove this. And then clean again. Ready for the next. Then clean also the surface. Okay, pahinga sandali ha. Ano pa ba?